Ryan from CARDV.
Take it away.
Thank you. I appreciate all of you doing this for your volunteer time. It's really amazing that you're here this evening. I hear your schedule. I can pass around a couple of handouts, please. My name's Tony Ryan. I'm the Executive Director of the Center Against Rape and Domestic Violence. I've been with the organization for 6 months. I was with an organization in Central Oregon prior to that for 14 years. And I'm delighted to be here. That CARDV has been in the community for 30 years providing domestic violence and sexual assault services. So as you'll see on the handout that's going around, primarily what we do is we provide emergency shelter, support groups, a 24-hour hotline for victims of domestic violence and sexual assault. The program I want to talk about tonight and what we've applied to United Way for $15,000 to support is our crisis response program. And the crisis response is a program where we have advocates going into the home when police officers have been there, where there's an incidence of domestic violence. It's an amazing program. This is one of the ones that impressed me so much when I joined the organization. It's based on it's a nationally recognized model. What we use is a screening tool called a lethality assessment protocol. And this program came out of Jacqueline Campbell's work with Johns Hopkins University back east. And what she looked at, she's been doing research on domestic violence for the last 25 years. And what she found was that only about 5%, or actually it was 4%, I'm sorry, of the murder victims across the country when they were murdered due to domestic violence would contact a program like CARDV. So very few people. And that was kind of validated a couple years ago. In '98, we did a needs assessment in the state of Oregon, and we found that it was about 10% of victims were going to a program like CARDV. So as much as we do public awareness campaigns, try to get the word out there, it's actually the hardest place to contact. So that was one of the reasons she started doing this specific research. The other one was that in 50% of the domestic violence-related homicides, officers had already been to that home, to that scene. So there were those two reasons. Victims weren't contacting programs, officers were going back to the same site. And the third reason was that the reassault of the domestic violence victims in these high danger cases were reduced by 60% if that victim got to a shelter. So this was out of her work and developed this lethality assessment program. It's used across the country. We've been trained through CARDV as advocates, and actually one of our advocates, Letitia Wilson, is now a trainer for the state. We work with all the law enforcement agencies in the area. Having been involved in this work for 20 years, I remember when it was really difficult to work with law enforcement. So again, where I just think this is an incredible program that we have this in this community. How it plays out is an officer is called to a home where something has happened, an incident has happened, and they'll assess the situation. They have a questionnaire of 11 questions that they ask the victim to really determine the danger level of the situation. They'll then offer the victim that they can have an advocate come on site, they can talk to him on the hotline. Either way, whether the victim talks to us or not at that time, the police officer gives us the information and we can do a follow-up call the next day. So this is what we're showing is that we're having a better success rate than the national data. That nationally they're saying 52% of victims get hooked up with programs. Locally we see 84% that we're actually working with after the incident. And again, this saves lives. It's shown now that we know that this reduces homicides due to domestic violence. So we're asking United Way to consider $15,000 for a grant award. It will support staffing for the program. It's the primary need. We have an advocate who's responsible every day for doing those follow-up calls, gets the green sheets from law enforcement, makes the calls the next day to contact, and that just greatly increases the chances that that person is going to get connected with the agency and find other resources that are available. The money, it's going to be spent on staffing. There is some additional costs like cell phones, some travel costs. We do a lot of transportation. We go as far as Sweet Home and out to the coast. We cover all of Benton and Lynn County, Sweet Home. We expect about a 5% increase in how many people will be serving. Last year we saw 1,500 people come through this program, and so we expect about 1,675 in the future. Likelihood of success, we know this program works. It's a research-based program, it's nationally recognized, and locally we're seeing lots of results. If somebody does come into shelter, we offer a feedback survey that we've been doing as part of a state program that we report on outcomes, and I've included the outcomes in the handout sheet. This is something that we can measure about if somebody does actually get more information about being safe, if they feel safe while they're in our program. And for the number of surveys that we get back, we get a 90% success rate already. So we know this program's successful. If we get 50% of our request, what we'd be looking at is really program delivery. We will continue the commitment with law enforcement. This is just, it's very progressive in this line of work to be able to have those kind of strong relationships, and it's not something that we would want to jeopardize. However, just how we offer the program, if we were really cut back, in addition to this cut, we're facing federal grant cuts. We're looking at 25% in our state grants, 50% in some other local grants, and so if we aren't able to sustain the level of staffing we have, we would probably not do night response. We would do it more through telephone response and follow up the next day. It just changes that, how many people we're going to actually connect, probably. We're really proud of being able to serve 84% of those contacts right now, and that might change in the future, but we will certainly be offering the service. I wanted to leave you with just a couple of highlights about where CARDV is going and what we're looking at. In the near future, one of the things we're working on is increasing our volunteer program. We currently have 112 volunteers that mostly help with administrative fundraising and doing public awareness out in the community, while we only have 15 direct service volunteers that are answering hotline. We hope to see that percentage shift. We want to keep our fundraising volunteers, but would like to come back next year and say that we've at least doubled, if not tripled, our other volunteers that are working on hotline, doing crisis response, going to the hospital. So we're really vamping up our volunteer program, and part of that is in response to these cuts that we're facing. We're also adjusting the program that we do in shelter. Currently we offer 30 days. It's actually 30 to 60 days. Most people stay 30 to 45. At the end of that short stay in an emergency shelter, it's really difficult to be self-sufficient. There's very little affordable housing, as you know, in the community. It's not enough time to get resources together to move into an independent living situation. So many people leave an emergency shelter and go into another questionable situation where they might not be as safe. So we're looking at trying to lengthen the stay. We'll keep some emergency beds. They're always needed. They're pretty much always full. However, we will take some of those beds and offer some people to stay for 6 months to a year. And that's preparing them for a new program that will be opening next year called the Advocacy Center, in which we'll provide supportive services to permanent housing. The permanent housing is being built by Willamette Neighborhood Housing Services. There'll be 10 units for domestic violence victims, and we'll have a building on site where we'll provide those services that will really help people get up back on their feet and long-term support. So I just am very proud to be affiliated with this organization. I think they're doing a remarkable job, and I think that it's well positioned for the future. So thank you again for your volunteer time and doing the United Way work. I appreciate it.
So this program then facilitates supporting contacting victims who've been referred by law enforcement like that. And you said this, and then the folks that you call, 84% will come into the shelter to receive a service or something.
They'll work with an advocate. They don't all come into shelter.
But some kind of connection so you can decrease the issues of the problems that
Exactly.
are lacking that. What kind of a number do you think you would get?
Without
Calling, without the contacts?
What kind of number? Well, we know. Right, the number would absolutely drop. Nationally, 4% of victims contacted a program before the program.
80% spread.
Mm-hmm. Yeah.
I guess I have a question about the abusers.
Mm-hmm.
It sounds like you guys are doing a tremendous job with people, women and children that are in these terrible situations. But does that mean that law enforcement is also progressive in making sure that these perpetrators of abuse are also dealt with?
They are, and actually, it's another thing that's just really come so far, the training that law enforcement gets, and that all the law enforcement agencies are participating with this lethality assessment speaks really well to the public safety response here. So they are trained in that. There's more of a burden on the court system to hold perpetrators accountable. So there's victim safety and batterer accountability is how we talk about it. CARDV's mission is the victim safety piece, and it's important to have that continuum, that batterers are held accountable. So we can all do better, but there is a good response in this area.
And we're out of time.
Okay, great, thank you very much.